Okay, so we are back with our 2 days of live coverage here at the American Colleges Horizon Conference in sunny Orlando. And next up we have Chet Bennetts. As you can tell, we do these live, who is the provost here at the college. Chet, thanks for joining us.
Yeah, thank you, Chuck.
All right, so we were talking a bit offline, and there's a lot of topics I knew you could cover.
Yes.
But one that I think would be particularly good, you recently-ish, a couple of years ago, did a dissertation.
Yes.
Essentially around behavioral finance, such an important topic.
Yeah.
Tell us about that, if you would.
Yeah, absolutely. So,
I should note it won a bunch of awards, too.
Oh, well, thank you. Yes. Yeah, so going from practice environment into academic environment, one of the things I think a lot of us as practitioners realize is that even the most logical financial decisions don't always get followed through. There's always something that comes up, whether it's a familial situation, a health situation, whatever, that kind of impedes the progress of the well-crafted financial plans that we put together. So really looking at that framework and trying to say, you know what, mental health medicine, physical health medicine, they integrate all three of these elements, biological, psychological, and sociological, to determine what combination of things will predict the best outcome. So translating that into financial planning, into retirement planning, into asset management was really the main aim of that dissertation. And the spoiler alert, in case you don't want to read the 400 pages of it.
Oh my gosh, is that how long those are?
Yeah, well, mine was.
Wow, holy smoke.
Yeah. But the spoiler alert is that when we look at all three of those, I think we're oftentimes surprised that it's not necessarily the physical health that's going to be the main thing that's going to affect the financial plan. It certainly can, and when it does, it's of a larger magnitude. But the two things that drive primarily are the mental health, the psychological health of an individual, with sociological health and physical health really being indirect indicators of it. Now, I'm not advocating that we all need to go into clinical psychology, nor should we be, most of us. Our own counselors may not like it if we're, if we're practicing.
Yes.
But it's imperative that as advisors, just like we do comprehensive risk tolerance, risk capacity, some of these mechanics to be able to determine the best allocation, I think as we continue to evolve and some of those things get automated, our human engagement is the human engagement.
Yes.
Yeah, so it's asking those questions.
There's a lot to unpack just with that.
Yes.
And, I've been an advisor myself for 30 years.
Yeah.
And it is so true. And if you talk to advisors, and I know you talk to a lot of advisors, myself included, I would say we oftentimes feel like we're therapists.
Yes.
Right? It's not just dollars and cents.
Right.
And I would like to try to bridge this over to this idea of, AI, robo-advisors taking over human advisors.
Sure.
I'm sorry, I don't see that.
Yep.
I see good advisors leveraging those tools, but if you believe, and I'm sure you do after 400 pages, I know I believe, that the behavioral finance aspect is so critical.
It is.
Can that be replaced with AI? I don't know. What do you think?
I don't think it'll be replaced as much as it's augmented.
Yeah.
So I've been talking about this for the last several years because we've done a lot of research at the college on AI and the use of it in financial planning. And the way I always liken it is to similar, we can probably recall WebMD, right?
Yes.
And when WebMD came out, doctors and the American Medical Association, everyone was up in arms because how dare some internet take the place of the practitioner. And I think we're seeing something similar with this in that WebMD did not replace the doctor. It may be made, for better or for worse, more informed patients, more informed consumers of healthcare, which allow
I'm laughing a little bit because we all know stories of people.
You know it.
You could be up at 2 o'clock in the morning and diagnose yourself with anything.
I'm dying. I'm clearly dying. This is exactly.
Right.
Well, I think what we've seen in the research is that there are a lot of people using AI for financial planning, for retirement planning. In one recent study that we did, there was 40%. These were people that were employed at a state and local government level, but 40% of them had engaged with AI, conversational AI, in some way, shape, or form about their personal finances. The largest segment of that group, over 70% of those that had an advisor were engaging AI.
Interesting.
Additionally, so there's multiple academic papers out there that we've written recently on that topic, but again, it's not a replacement, it's just our profession needs to have, just like the medical professionals did, this understanding that our consumers are going to come to us, and before they had a preconceived notion or bias or whatever that was maybe uninformed, ill-informed, etc., Now they're coming to us with an additional layer of bias that is oftentimes, enlightened by an AI. And again, for better or for worse, history will tell, future research will show. But I think it just means we have to change that conversation just a little bit and acknowledge that that is happening.
All right. Well, I tell you what, Chet, that's a great place to put a pin in it for today. Thank you so much for joining me.
Thank you, Chuck.
Okay. So we have 2 more segments to go for later this afternoon. I'll be back after the lunch break with some more content. I will see you then. All right, Chet, that was great. Thank you so much.
Sure.